this 2-minute pitch, I'll be talking about the legalization of neonatal euthanasia in Holland. Legalized under a strict set of conditions mapped out by Edward Verhagen, a physician and one of the major proponents of neonatal euthanasia in Holland. I will be arguing that neonatal euthanasia is morally permissible under these strict conditions. The principle of autonomy dictates that autonomous individuals should be allowed to act autonomously. In other words, people should have control over their personal lives. Matters of life and death are personal to most people. Timing and cause of death are therefore encompassed by autonomy. People should be able to choose how and when they die. In medicine, informed consent is necessary to fulfilling the principle of autonomy. Verhagen's conditions emphasize a need for parental consent after consultation with many other physicians. Under these conditions, the requirements of informed consent are met. Neonatal euthanasia performed under the circumstances described by Verhagen is morally permissible because it allows people to act autonomously. Opponents of neonatal euthanasia may argue that the significant moral difference between neonatal euthanasia and other kinds of euthanasia is that babies cannot express informed consent to death. Because of that, they say, autonomy cannot be respected. Because infants can't make decisions about their treatment, the parents would have to make decisions for the child. Surrogates give consent for people all the time in medicine, whether the patient is a child or an incompetent adult. In such a scenario, extra care should be taken to make sure that the surrogates are as informed as possible. Like I said before, under Verhagen's conditions, parents would have to consult multiple physicians and be fully informed before they come to their decision. Parents would therefore be able to make informed decisions about their child's health under these conditions. Neonatal euthanasia can therefore be morally permissible even though infants can't consent to death themselves. Physicians also have a duty of beneficence, which means doing the most good they possibly can for their patients. Verhagen's conditions for the permissibility of neonatal euthanasia include unbearable suffering caused by an incurable medical condition. In these conditions, death would bring more good to the patient than continued treatment, because the pain would never get better. Under Verhagen's conditions, then, where both the physicians and the parents agree that death would bring the child more good than continued treatment, the physician would therefore be morally obligated to help the infant pass on. According to Daniel Callahan, the purpose of medicine is to treat physical ailments, not the patient's happiness and well-being, which are the issues when a patient considers death. Because of this, he would say that euthanasia of any kind is incompatible with beneficence. Fallacious because it hinges on the premise that mental well-being and physical well-being are completely separate. This isn't true in the slightest. Happiness and physical health are inextricably linked. Mental well-being is therefore well within the scope of medicine. Physicians do treat well-being all the time, and if euthanasia is the optimal treatment for a patient's mental state, then euthanasia is morally permissible. Callahan also argues that abuses to a law legalizing any kind of euthanasia are inevitable. This is a slippery slope argument, which are usually fallacious. But this is especially fallacious because Holland would have been the first country to legalize neonatal euthanasia. Because of this, there can't possibly be enough data to infer negative consequences of neonatal euthanasia. Additionally, all laws are abused by some people, but that isn't a legitimate grounds for not having the law at all. Just because some people abuse it doesn't mean everyone will. The fact that abuse of a law permitting neonatal euthanasia is inevitable, therefore doesn't render the practice impermissible.